The one thing that I would look very strongly at is when I'm doing a bona fide service fee agreement between a manufacturer and a specialty pharmacy, I want to make sure that I'm measuring inputs, and I'm measuring those inputs very accurately. And then I'm making sure that the items that I'm purchasing have very robust metrics around those items. So if I'm a manufacturer and I'm purchasing data, I'm making sure that the data is robust data, that it's valuable data to me as a manufacturer, that the specialty pharmacy is delivering the data that they say, and that I'm not compensating where the data is not being delivered. Very, very focused on that right now. If I'm doing compliance and persistency programs, I'm making sure that I can measure the interactions they're having with the patients, that they can evidence those interactions, and that I'm compensating very specifically for the interactions that are being made. Secondly, one of the things I didn't mention earlier is that as a result of some of the changes around high-tech and HIPAA on the compliance and persistency contracts, we have to be very careful about how we compensate for those interactions with patients as a manufacturer. We have to make sure that we're compensating for indirect and direct cost, but not necessarily anything more than that. So there's some real careful things I'm doing around making sure my compensation is strong. The last thing that I'm looking for in my contracts is I'm making sure that as a manufacturer that I'm very focused on measuring fair market value. And I'm making sure that I'm not overpaying or underpaying. And ironically, both can be problematic. I'm making sure that I'm paying a fair market value rate for whatever I'm purchasing from the specialty pharmacy that is fully defensible and that is defensible with outside third-party evaluations. So, as a manufacturer, I think that's a very important thing to do. So as a contract, those are the things I'm looking for.